Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Very often, most importantly, when we begin a fertility treatment, whether it is ovulation induction, where tablets or medications are given for your egg to grow and for you to try naturally during that cycle, or it is an IUI, intrauterine insemination, where the egg is grown, released, and your partner's sperms are taken, processed and placed in the uterus, or it is an IVF. Whatever the kind of treatment, usually your fertility specialist will encourage you to come on day 2 of your period. That is, if you started your bleed today, they'll ask you to come tomorrow or the maximum day 3 for an ultrasonography. What is the importance of this ultrasonograph? And let's try to understand what happens if you miss it. Remember that when you start bleeding, when the period begins, it means that the uterus has begun shed. That is, before it is beginning to shed, remember what's happening inside. Just try to understand. The egg has ovulated and it's waiting in the tube. From the spot that it ovulated, there is a hormone called progesterone that is released. Progesterone is released, which helps in the growth of the endometrium, which is the innermost layer of the uterus where the embryo is supposed to implant. When this progesterone is released, the blood supply to endometrium increases. Now, suppose there is no pregnancy, this progesterone level comes down because there is no embryo that is implanted. Therefore, after some time, the endometrial layer also starts shedding. So this is what is happening in a period. Now, once you start bleeding, the ovary is behaving differently and the endometrium is behaving differently. The ovaries now get prepared for the next cycle. They start getting hormonal signals from the brain, FSH, luteinizing hormone, mostly estrogen and FSH, follicle stimulating hormone, getting ready for the next cycle, which is again the egg has to grow, again it has to be released. So on day 2, it is the baseline because it is now getting ready for the next release of egg. Your body is physiologically waiting for the next pregnancy chance, potential of it. So on day 2, if you look at the ovaries, we get to see how many eggs are growing, which means only one will ovulate, of course, but what is your egg reserve is what is assessed, and also your endometrial lining is also seen. Is it shedding properly the way it should on day 2 of your period? Is hormone level okay? Of course, which is correlated with a hormonal examination by blood. So day 2 is very important because we're trying to understand how your ovaries and endometrium will behave in case we're planning for pregnancy or fertility treatment. Have your ovaries and endometrium assessed by a ultrasonography on day 2 or day 3 of your period. If you have more queries, if you want to understand just how your ovaries and endometrium are behaving and you're planning a natural pregnancy, you want to understand what's happening, please feel free to contact us on the numbers that you see on the screen. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.